Ashley Qualls, and this is my halfway head to toe video. Hi, my name is Ashley Qualls. I'm going to be your nurse today. We're going to start off with a physical assessment. Could you tell me your name and date of birth?
Sarah Nedley, July 13th, 1993.
And why did you come to the clinic today?
Just for a checkup.
Just for a check. How are you feeling?
I'm feeling good.
Okay. And so through that little conversation, I could tell that she had good thought process. She was alert, and she was oriented. She could hear well. Her speech was clear and spontaneous. She's well groomed. She's appropriately dressed for the weather, and her hygiene is adequate. Also, I watched her walk into the room and I assessed her gait. And now I will begin the actual assessment. So we're going to start with the head. I'm going to be looking to see for symmetry. Her head looks very symmetrical. Then I'm going to palpate. I'm just going to be checking the scalp to start off with, trying to find any lesions, any bumps, maybe moles, anything like that. And then through that I'm also checking the hair. It's fine. It's a red color. It's thick and doesn't have any patches of baldness. Have you ever had any head injuries?
No.
Okay, so while I was palpating, I was also palpating the cranium, and I also felt like she didn't have any like scar tissue or bumps, and so that is makes sense with her saying that she's never had a head injury. And so I'm also going to palpate the temporal artery and the temporal membral joint. If you could open and close your mouth. Okay, and it was smooth. And then I'm going to palpate the frontal and maxillary sinuses, checking to see if there's any inflammation. Tell me if there's any tenderness. Okay. Alright, and then we'll move on to the eyes. First checking for symmetry, noticing any drainage or anything of that nature. And without seeing that, I can move on to, I'm going to check the conjunctiva and the sclera. So I'm just going to pull down your eyelids. Your conjunctiva is pink and the sclera is white. The pupils are about 5 millimeters. They are round and equal. I'm going to check her peripheral vision. I'm going to stand to each side of you and just tell me when you see my finger.
Okay.
Okay. Okay. Okay. And so peripheral vision is intact. Then I'm going to grab a light source. Okay. And I'm going to check for pupil constriction. I'm going to shine a light 2 times in each eye. The reactions were brisk and equal. Check for accommodation. I'm going to have you look at my pen light and now look at the wall and look at the pen light. Okay, accommodation was present. Now I'm going to check for the corneal light reflex. Checking to see if the light is equal in both eyes, and it is. It's present. Now I will check cranial nerves 3, 4, and 6. If you'll just follow my finger. Very good. Okay. I want to also check her cornea. So I can just shine a light through this way. I can see that it is smooth and without lesions. Next I will check her ear. I can just inspect them, see if they are symmetrically placed. They are. Noting any drainage, any lesions, anything of abnormal things. Then I would grab an otoscope and I pull back the pinea up and back, check for in the canal and for the tympanic membrane. Okay, and then I check the other ear. Okay, very good. And then I would do the whisper test. If I could have you cover your left ear and repeat back to me the letters and words I'm saying.
4B810.
Okay, and I'll check the other ear. You'll cover that ear.
372.
All right. Her hearing is good. Next, I will check the nose, looking for any drainage, lesions, symmetry, and seeing if it's midline in the face. And it is. I would grab a speculum, and I would check the inside of her nose. Okay, there's no deviated septum. There's no lesions. There's no drainage. Nothing abnormal to note. Then I would check her mouth. If you will smile for me. Alright, that just checks the cranial nerve, the facial cranial nerve. Stick out your tongue, and that checks the hypoglossal cranial nerve. Okay, and then can you open up your mouth? Okay, say ah.
Ah.
Okay, I saw the uvula and it went up, and that checks the cranial nerve, the gag reflex. And then I saw that her mucosa was pink and moist, and there was no odorous breath. It means good hygiene. Teeth are white. I will grab a glove to palpate. Okay, if I can have you open up your mouth. Okay. Buccal mucosa is soft, moist, and pliable. Hard palate. It's hard. Tongue is good. If you'll lift up your tongue, and I can see that it's red underneath there as well. Okay. Then I will palpate the lymphatics, checking to see if there is anything large. Most of the lymphatics aren't necessarily very palpable, so if I really feel anything, that means that there's probably could be an infection. Okay, then I'm going to check the accessory cranial nerve, and if you will just shrug your shoulders. Okay, so she has strength. Turn your head to either side. She has good range of motion, back and front. Very good. Then I'm going to palpate the trachea and the thyroid. For the thyroid, I'll be going behind you. So do the trachea, and for the thyroid, I will move it over, the trachea over a little bit, and try and go between. And if you'll swallow for me. Alright. Thyroid doesn't seem enlarged. Next I will go to the thoracic cavity. If you'll lean forward just a little bit. First I'm inspecting her chest, her posterior chest. Symmetrical. I don't see anything of abnormalities. Good cage. Then I will palpate for tactile firmitus. When I put my hand to your skin, just say 99.
99. 99. 99. 99. 99. 99. 99. 99.
Okay, and so all of the vibrations were equal bilaterally. Then I will check for symmetric expansion. So if you will just breathe in deeply. Okay, my thumbs spread out equidistant, and that means that her expansion is symmetrical. Then I'm going to palpate for the cavity. I heard a nice resonant sound. Now I'm going to auscultate. Every time I move my stethoscope, please take a deep breath. Your posterior lung sounds were clear bilaterally and through to the bases. Next I will do the anterior chest, examining for symmetry, and then do the testing for the tactile rheumatus. Say 99.
99, 99, 99, 99, 99, 99.
Okay. Vibrations were equal bilaterally. Then I'll palpate for the cavity. Alright, I heard a really good resonance. I went a little too far below, and I heard a deep sound, and so that just means I wasn't in the right place. Now I will auscultate. Deep breath. Very good. And now I will do the one abnormality test, the bronchophony. Every time I place my stethoscope on your back, please say 99.
99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99.
Okay, the 99 was not clear, which means that she is good. Next I will auscultate the heart valves. This is the mitral valve. Pulmonic. Oh, this is the aortic valve, sorry. This is the pulmonic. This is the tricuspid. Okay. And then this is the mitral. And here I will count the apical pulse and its rhythm for a minute. her apical pulse was 67. She had a regular rhythm with audible S1 and S2. And I do believe that concludes the assessment. Thank you.